the first section we talked about you, and the second section we want to hear you talk about us, basically, S.C.C.O. We know that statistically speaking, you guys being applicants for optometry school, apply to 5 to 7 different schools. And we know that, it's okay, but we want to know that you have been intelligent about the process, that you've looked into the other schools. As much as we'd love to hear that we're the only one you're considering and the only place you want to be, we know that's not realistic. So we just want to know that you've looked into our program. We want to know why our program stands out from others, and so be able to articulate that. You want to give us some examples?
Well, yeah, and I always, Eryn knows my boyfriend analogy. It's like, it's an awkward time in the program because in the interview, when we ask you, well, you know you're applying to other schools, tell us about your thought processes. Your tendency is to like say, oh, you're the one, you're the only one. But, I use the analogy, it'd be like if I was, I know you're applying to 4 other schools, and it would be like if I was your girlfriend and I walked up to you and say, hey, I know you're seeing 4 other women besides me, but, how am I doing? So it's really awkward. It makes you feel awkward, but no, you shouldn't be. We expect you to research the other schools. We expect you to be contemplative about the process. So now's the time to talk about, the different programs, things you like, and things that that you favor in one program over another. In other words, we want to know that you've been contemplative about the process. We want to know that S.C.C.O is a good fit for you because ultimately we want you to be a happy student body member while you're here. So that's why that's important. I'm going to tell you a couple of things about our school that we're kind of really known for, but I have a list of why choose S.C.C.O. Items about our school that we think's really special, and you can email us here at Student Affairs, and I'm sure you're going to see a little prompt at the bottom during this broadcast about that. So
should we point to
should we point it there and watch the bouncing balls down here? But you can email us for that. But
the bouncing eyeball.
Yeah, about the bouncing eyeball. Okay, but the reason I prompt you to go ahead and maybe email us for these why choose S.C.C.O. is not only to read about our school, but also you can kind of use it as a review list to kind of contrast and compare to other programs. The number one thing about S.C.C.O. is our clinical program, our clinical education. Now, let me tell you what that is. And you think, well, gee, doesn't everybody have a clinic? Aren't I going to see patients when I go to any program? And it's not necessarily if you're going to see patients, but it's the amount of visits you're going to have and the diversity of the kind of patient visits you get. In your 4th year here, you do 4 3-month rotations. Okay, you do 1 on our eye care clinic. We have a big facility on campus, eye care center, I should say. Correct? It's the ECC Eye Care Center, and you do 1 of your rotations there. For your other 3, through a lottery system, you get to rotate through 1 of our 81 outreach clinics that we have set up all over the United States. We have 2 in Canada, 1 in Japan, 1 in Guam. We have 1 in Hawaii, but I never like to say that because it's one of the first choices to go. It's so popular. But if you be the lucky lottery winner, you too can spend a rotation in Hawaii. But no, I say that because you have to see between 2,500 to 3,500 patient visits before you graduate. And it would be absolutely ridiculous for you to see 3,500 of the same patient. What would you learn? So you really rely on a program to have enough diversity in its patient base to get all the patient visits and all the different kinds of cases. You want a diversity in age, ethnicity, and that's the way you get to apply your clinical education. It's a huge program.
One of the other things I like about that program is that in your first 3 years, if you find out that you really have an affinity towards ocular disease or towards pediatrics, you can cater your 4th year to that program. So if you just know this is it for me, then you can go to all sites that cater towards that. But if you're kind of like, I'm liking the general, I still want to feel things out and get a better in-depth, 3 months is a good chance of seeing a lot of different things in that area, you can go to 3 different areas plus our clinic here. So you really get to kind of choose your own adventure for the 4th year.
Yeah, and Eryn's making the point. Each one of the rotation sites will see a particular kind of patient. For example, like let's say Eryn said you have an interest in pediatric optometry. Maybe that's what you think you want to practice after having your general education here. and you pick one of the rotations, then for pediatrics, you'd be picking one that would be maybe on a military base where they see lots of families and kids. But let's say you really have an interest in ocular disease and that's what you want to specialize in, that's where you want to go. You could pick all your three rotation sites at, for example, one of our Indian Health Services clinics in the Southwest. They see a lot of pathology in those clinics, and so that would be the place to go. In your general education, up through your third year, you get exposed to the different, those different specialties in optometry, but that fourth year really is the year you want to focus in and pursue your interests. And like Eryn said, you can tailor your last year's education to meet your interest level with a program that's that big. The ACOE is an accreditation body that accredits all the colleges and schools of optometry along with WASC accreditation. And in their report that we had, the last report they had written about our clinical rotation, our outreach program we call it, is that it was unparalleled in optometric education. So we're pretty proud of that, and we want to toot that horn, understandably so. We have a really accessible faculty, and I mentioned that faculty work here with you differently than they would in your undergrad education because those class sizes are so small. But the same faculty that teach your lecture courses are the faculty that will teach you in the labs where you're learning to use the optometric instrumentation. So, we don't have TAs teaching those courses. Most of the faculty give students their cell phone numbers. I mean, they're very available. We're in a great community here. In terms of another thing about S.C.C.O, we're in a suburban neighborhood. 50% of our students live within just a mile of campus, which means that we have a lot of students on campus, a lot of campus community most of the time. I live just 2 miles from campus. It's a lovely neighborhood, so students feel safe here, and it's a nice place to attend school. And guess what's only 7 miles away?
Disneyland!
You're not supposed to say that. Don't in the interview say that you want to come to S.C.C.O because it's close to Disneyland. Even though they'll say you've been talking to Dr. Munroe because everybody knows I'm a fan. Although we have a lot of season pass holder faculty that are season pass holders and students that are season pass holders.
I'm not, so you can still come even if you're not a Mickey Mouse diehard fan.
That's right, but you'll earn points in my book if you are, so there you go. There's many more reasons that we'd like you to know about our program, and of course you'd want to be able to talk about those intelligently in the interview. So like I say, email us for that expanded list of why choose S.C.C.O.